right, everybody, welcome back to Business Success Chronicles. I'm here today with Rob Worth, Dr. Rob Worth, I imagine, who is the owner and founder of Advanced Physical Therapy and Sports Medicine from 1998. So one of the really talented people that keeps a business going for more than 25 years. Rob's schooling includes lacrosse, St. Augustine, and then Harvard, and I imagine a residency at Mass General to finish up your PT doctorate. So welcome, Rob.
Thank you, Mike. Thank you. It's an honor to be here. I've listened to several podcasts and you've had some great people on the show and look forward to doing another great show with you.
Yeah, I'm excited to have you. And you made a statement when we were chatting earlier about the journey of the 16-year-old Rob Worth to today that I think I'd like to hear now.
Sure, be happy to share, Mike. So, some of the things we had chatted about before before going live here was just kind of our journey. I think we've all had journeys. It's interesting to hear about where you start and where you end, and probably most importantly, what happens along the way.
Sure.
So, 16 years old, I think many 16-year-olds, I did not have my life figured out yet, and I thought, my gosh, I'm 16 years old, and I don't have my career path laid out for the rest of my life. I need to get going on this. So I actually made a list of things that I was looking for criteria for my career. So on that list was one, I knew I wanted to do something in healthcare. Two, I wanted to do something on the wellness side of healthcare. And three, and probably most importantly, I wanted to be able to look back at the end of my career and say that I made a significant positive difference on many people's lives. So those three criteria, I went out and did some searching and found the field of physical therapy. And I thought, I think this might be it. So I called up the local hospital. This is before the days of job shadowing actually being a thing, and said, hey, can I go into your physical therapy department and spend an hour with you before school from 6:30 till 7:30 in the mornings, and did that for a month, several times per week. And I thought, yep, this is absolutely it. And fast forward, went to PT school, never looked back, and it's been an amazing career, and kind of specific to the topic for today, in this area of business, and in this case, physical therapy business. Had graduated from UW La Crosse, and I practiced for a couple of years, working for a healthcare system. Practiced for a couple of years being a clinic manager for a large national PT company, and then about 26 years ago, my wife and I had our first child. And so our child was 3 weeks old, and we were leaving to go to Florida, because at this point I was doing a manual therapy residency and would be spending a month in Florida. So my wife and I are driving to Florida with a 3-week-old in the back seat as we're driving. And the day before we left, an orthopedic surgeon I work with said, hey, Rob, I'm thinking about opening up a sports medicine business, and it'd be great to work with you. Have you ever thought about opening up your own business in physical therapy and sports medicine? I said, well, I hadn't, but let me give some thought. My wife and I are driving to Florida tomorrow. So my poor wife had to listen to 22 hours of driving of the pros and cons of quitting my stable job and starting business from scratch with our 3-week-old in the back. So, so the good news, best news is, so one of the good news is the business has been successful. And probably the better news is we've survived 31 years of wonderful marriage. So, yes, and our son is 26 years old, and the business has gone well. Honestly, it's grown more than we ever expected that it would, and it's been a blessed journey, and feel very fortunate to be where we're at.
Yeah, three-week-old baby, and jumping into entrepreneurship, that's pretty not risk averse, let's say. But
no, it worked out well. But yes, it was definitely, I give my wife credit for having the confidence and the support to let it fly.
Sure. And knowing, making a decision at 16 years old, sticking with it for a whole career, that's pretty unique, like pretty focused. So that's interesting. I haven't talked to anybody who's been as focused on that for a long period of time. So that's super cool journey.
Well, thank you. And honestly, even to this day, Mike, I still feel like, I've got the best job in the world. I get up every morning and literally am excited to go to work. I was talking to a colleague of mine who said his percentage of fun versus not fun at work is about 50-50. He said a good day is that he has fun more than half the time he's at work. And I said, honestly, 99% of my day is just pure fun.
Wow, that's awesome. So tell us a little bit more about advanced physical therapy and sports medicine. Do you have a target market? Do you have specialties? I mean, subspecialties? Tell us a
Sure.
little bit about the business and how it's developed.
Yeah, yeah. And I think to add to the story, the journey of the 16-year-old. So when my wife and I, when I decided to open a practice, my wife supported that. I realized that, this is now 2 months later, you're getting all the things in place to open up a business. And I thought, well, at some point in time, I will probably want to take a day off or take a vacation. So I called up a good friend and colleague of mine, Tracy Razor, and I say, Tracy, I'm thinking about starting this business, and I think I might need, some vacation coverage once in a while. Would you ever be interested in covering vacation? And she said, sure. I said, well, would you ever just want to work part-time for me? She said, sure. I said, would you just like to be a partner? She said, sure. And it was literally that fast. And and after that 10-minute conversation, we opened up advanced physical therapy and sports medicine with myself and Tracy, who was also a physical therapist and licensed athletic trainer, and had an office person. And honestly, we had 900 square feet. We thought, this is it. We'll do great things in our community and take care of our patients, one patient at a time. And honestly, that was our vision, was to just do good work and take excellent care of our patients. And
Yep.
over the course of 26 years, we've been very blessed. And had you told us that we'd grow to 29 clinics and 60 on-site clinics at various companies and industries, we never would have guessed it, going from 3 people to 173 people on our team. And honestly, as much as we've been blessed with growth, I think we said no to as many opportunities we've said yes to, and that our goal has always been to, kind of control growth and stay small and just do really good work. And we've been pulled into growth a lot more than we pushed into growth, and that philosophy has worked well for us.
So these are not questions on the list that I prepped you for, but it's
That's
so
okay. Bring it
interesting
on.
to me because the biggest thing that holds entrepreneurs back on growth is fear. But the fear tends to be fear of letting go or having somebody else on your team that might be as good as you at a 99% happy ratio. How do you just skip right past all that? Like, you show no reluctance to have people on the team. Tell me about this getting pulled into growth thing, because it's so cool. Most people push back hard when growth opportunities come up because it messes with their self-identity of, who they are and what they're supposed to do. You don't have any of that. That's
Well,
super cool.
and thank you, Mike. And then that's a great question. Yeah, I think, I don't know, from my perspective, I think to answer your question as far as the push versus pull, I mean, we've seen a lot of companies that I think their emphasis is on growth and financial success. And honestly, our approach has always been, if you do the right thing, you take care of the community, and you try and be the best version of yourself as an individual and yourselves as a company, the financial success seems to come, and the growth kind of comes naturally. And as I kind of alluded to, we so much love the culture that we have within our business, within our practice, that we didn't want to lose that family feel. So that's why I say that we've been pulled into growth rather than actively trying to grow. We've had, physician groups, communities, industries, businesses that have said, hey, we'd really love, we've heard good things, we've experienced good things, we'd love to have you come into our community, serve our community. And that's really been kind of the impetus for a lot of our growth is word of mouth. And again, just, I think, making a positive difference and having that word spread. And
Yeah.
I think to answer your second question, as far as, being comfortable with, with letting go. My gosh, I hope half people on our team are smarter than I am, because if everything is dependent upon me, boy, we're in trouble. But I think that you do what you do well, and you bring other people onto the team that do what they do well. And even as I reflect back on the beginning of our business, so when we first started, as I mentioned, it is myself
Mhm.
and a friend and colleague, Tracy Razor, and what I think I brought to the table was this, maybe a little bit of business expertise. A little bit of clinical expertise and a lot of drive, maybe too much drive. And what she brought to the table, I think, was one, the people skills and the importance of people and soft skills. And I think also having fun and not taking yourself too seriously. So I think that's what she taught me and mentored me in. And I speak with her in past tense. She passed away from cancer about 11 years ago, so she's still
Sorry to
certainly
hear
in our
that.
hearts. And I think she'd be proud of where we've landed as a company, what we continue to do for our communities.
So we're way off track with the questions, but you said my favorite word, which is culture. And one of the things that we've learned is really your only competitive advantage is the people that work for you. So how would you describe what your culture is? How intentional is it? How do you keep it in place? Because I almost can't. We're doing a program with a big customer tomorrow, and the number one thing they have is a bad culture, and the leaders don't get it. So they have, turnover and all this stuff that happens because of it. Like, how did you create yours? How intentional are you? How much work is it to maintain it? Like, how did you get to that spot?
And I think I can answer all those questions, Mike. I would say, yeah, at the risk of sounding trite, it doesn't feel like that much work. And the reason I say that is because
Yeah,
I think that if you have people that naturally, from an integrity standpoint, from a humility standpoint, from a human being standpoint, that are consistent with your culture, it doesn't feel like a lot of work. So I think that we've always taken the position of always doing the most right thing, the right things with the right people, and good things tend to happen, and always doing the most right things. So I think those have been philosophies that have always, I think, been our guiding light. And a funny story. So I'm part of a group called Vistage. Are you familiar with Vistage,
yeah,
Mike?
sure. Yep, yep.
Yes.
We have a
So I'm part
handful
of
of
the Vistage.
clients that are there.
Yeah. So a few years ago, the Vistage group brought in a speaker, and the big emphasis was on culture, and everyone was trying to write these culture playbooks and culture
Yeah,
programs to write their culture. And we've been doing this for about 4 or 5 months in this group. And again, great work and some great things being done. And I kind of got picked on a little bit by my in a nice way by my Vistage members. And then like Rob said, you have our group probably one of the best cultures out of all of our companies, yet you've done the worst job of writing it down. And I think it's because I guess my thoughts on this have always been if you live it, you shouldn't have to write it. So I think one of my, I don't have many pet peeves, but one of my little pet peeves is you walk into business and you look up on the wall and it's in a gold frame
yeah,
and it's got
yep,
this nice glass with the top of it. It says our values are integrity, taking care of our people, and it's got this great litany of things. And then you look around the room and you see none of that actually happening. So we never wanted to be that company. So I always took the approach that if we live it, we shouldn't have to write it down. Though fortunately, we ultimately were convinced that, hey, you know what, we do need to write this down. One, to help, I think, increase the learning curve of people that come into our group, so that way it doesn't take 6 months to say, oh, this is what they're really about, but they
sure.
can see it from day one. So I think it's helped us kind of just bring people on and immediately get a sense for who we are.
Yeah, we like I went through lots of culture stuff, and for me, we usually have what are the behaviors that are the right things that you want your people to do, because leadership then becomes, did you live up to the most right thing? In your case, right? Like if there's ever a problem, then a leader's real role is, hey, did you live up is that the most right thing that we should do for that situation? And where do they have to go, right? It's not like they can say, well, I wanted to phone it in today and do half my job, because that's not an answer to, is that the most right thing? I think that might be one of the best statements of what are we here for that I've ever heard, which is super cool because I've heard a, heard a lot. But I think what you said that your Vistage people are asking you about, first of all, if when y'all are listening to this, think on that. The most right thing. Are you doing the most right thing for your customers, your teammates, the business? But what your Vistage team said is super interesting, because at the end of the day, it's a pretty simple game, this game of business, right? Have smart people, take great care of them, provide a great service to the community, and all the rest of it seems to be overcomplicating. And again, you've just cut right through all that stuff. And here's what we're for. It's awesome to hear that.
Yeah, couldn't
So
agree more, Mike.
yeah, tell us a little bit about somebody who inspired you, and maybe what your biggest learning from them was on your journey so far.
Sure. And I've been fortunate to have, I think a lot of people have inspired me, probably like many of us have. So I think, to pick one is always challenging, but I think if I can pick, groupings, if you will,
Sure.
certainly my wife and kids, who are now, I can't really say they're kids, at 23 and 26 years old boys, they're probably not kids anymore, but I think the ongoing and constant support, and I would even say tolerance of my wife and two boys has been fantastic. So that certainly has been one aspect. I think the second category I would say has been the fantastic practice partner that I have. I have 15 practice partners that we brought in, over the years that, again, I think when you have this great team of superheroes doing all great stuff for all the right reasons, it makes it easy, and makes it fun, and makes it exciting. We actually just got back yesterday, 2 days ago, from our annual strategic planning meeting. We spent 2 days on a lake at a lake house and talked strategy and talked vision. And so coming out that, certainly, that group, my group of practice partners, certainly inspires me. And then the final group I would say is, and I don't know how unique this is to our industry versus others, but we have got a great community of physical therapy business owners, both at the state level. And there are 6 CEOs that I can call this afternoon in a pinch, and they'd be right there to help me out, and vice versa for them. And at the national level, I'm also on our national board of directors for physical therapists in business,
Yeah.
currently serving as vice president. And within that group, there's a tremendous amount of support and resources that, truly, rising tides raise all ships. So that's kind of, I guess, the 3 categories of people that continue to inspire and support me.
Yeah. It's pretty unique. I mean, you would think that the world would be full of abundance, and, parts of the world are full of abundance, but there's a lot of industries where they think if you're being successful, it's coming out of their skin somehow. And so to hear that you have that many people to call on, yeah, that's special. So how about the biggest challenges? What's the biggest challenge that you've overcome in the journey so far?
All right. Well, and I know that was almost a potential questions, and I was debating, do you go casual or do you go deep? So I will go deep with you, Mike. I'll share something
Okay.
with you that I think only a few people know. So, it gets a little personal. So when I was in PT school, we talked about my journey from 16 years old, and looking back, there's nothing else I wanted to be other than like the best physical therapist, that I could be. So fast forward, I'm in PT school, so I'm at this point now a year and a half away from graduating. And my part-time job in college was working as a group home, a counselor at a group home for development disabled. And during that time, the head counselor had stepped away, so there's no one left to lead that group home. So I felt obligated to step up and lead the group home while also going through all my grueling classes, and ended up getting a
Wow.
D on a test, which you're not allowed to do and stay in the program. So here, a year and a half away from graduation, trying to do, again, the most right thing by taking care of all the residents at this group home, had a little blip on my grades, and as a result found myself kicked out of PT school and not knowing where I was going to go, what I was going to do, and um, hunkered down, and knew that nothing's changed, and figured out a way to get back in, and had one of the best faculty mentors ever. I think you get those teachers along your life that
Every now and
make a
then.
difference. And
Yeah.
I'll give a shout out to Gwen Straker, who was a person that said, hang in there, you're going to get through this. Got back in, graduated from PT school, did all the things we talked about, and to kind of put a cherry on top, they had developed an award for the distinguished alumni. And the very first year they had the distinguished alumni award to be the keynote speaker graduation, they had selected me, who had been kicked out of their program 18 years later. So it has come a nice full circle. So there we go.
Congratulations.
I went deep on you, Mike.
I mean, they call that grit and determination. And, it underpins seemingly all great accomplishments, but that's an amazing story. Thanks for sharing that with us. What's the next big thing for advanced physical therapy and sports medicine if you look forward to the next 1 to 3 years?
As we look at the next couple of years for advanced physical therapy and sports medicine, I think that, can we edit right now? Only because the dogs are barking. Is that cool, Mike?
I didn't hear him.
Okay, great. So our dogs are not big fans of the FedEx man, so he's here now. So,
Got it.
so to answer your question, so advanced physical therapy and sports medicine, I think has, we've been very blessed with growth, and again, more than we expect. I think the biggest opportunities for us are a couple. One, continuing to serve our communities through the 29 clinics that we currently have throughout Northeast and Central Wisconsin. And I think probably even more exciting is that I alluded to this at the beginning. So our fastest growing division by far is two divisions. One is advanced industrial medicine, and the other one is advanced tactical medicine. Advanced industrial medicine provides on-site injury prevention, injury care at just about 60 companies. So 60, mostly in Wisconsin, but also in other states such as Florida, Utah, North Carolina, Illinois, Iowa. So it's an opportunity to reduce work-related injuries. We've had significant cost savings that employers come back to us with, combined with the other branch, which is advanced tactical medicine, which serves police, fire, sheriff, and doing injury prevention, on-site injury care. So essentially how it works is, instead of going in to see, ER or urgent care walk-in, we have on-site providers that can take care of acute injuries, provide treatment, and prevent them from even having to go into the clinic or the hospital. And we've had just some fantastic results. Typically, there's been a 9-to-1 ROI for the company we work with. We actually had a company recently that we went and did an end of the year analysis, and I said, we believe that we saved you $1.3 million in healthcare. And the CFO kind of looked down and said, we did our own analysis. Slides paper over to me, said, you saved us $1.6 million. Thank you.
That's amazing. I've heard of the industrial. I used to work in factories when I was younger, and so we had like the beginnings of that when they were trying to figure out how the PT and healthcare industry could like co-locate in the factories and help us keep things, treated at the right level, so to speak. But I hadn't heard of tactical. That's super cool.
Yeah, we're fortunate to have on our team the individual that leads our advanced industrial medicine and advanced tactical medicine. She leads both brands, has actually spoken nationally and internationally to police, fire, and sheriff organizations. So we feel like we have really one of the best in the country, and then some, leading that team. And again, she's been a featured speaker at many of these conferences all around the country, and has actually developed protocols and programs that have been just kind of leading the way for that division and that servicing that population, which has been really cool.
That is cool.
Again, take care of others who take care of us.
Yeah. One final question that definitely wasn't on the list of questions I send people, and that is, if there is something you wanted me to ask you that I didn't, what would that be? If anything.
I think first of all, Mike, you've done a great job of the dialogue. And I love the fact that, we took 10 scripted questions and tossed them in the garbage. And I think we had a good discussion. So that's what I hope is that, people listening to this, one, can relate to a few things. And two, I think we talked earlier about people that influence you. So I think, one of the keys, I think, to our success and hopefully others is that, one, to look for people, surround yourself with people that are mentors that can help you out and get you to where you want to be. And then just as importantly, at some point in time, you're going to become the old guy or the old gal, and you're going to be paying it forward. And now I find in this point in my career, after doing this for 26 years being in business, I'm now having the opportunity of people reaching out to me saying, hey, can I have an hour of your time once a month because I'm starting this business, and would you have lunch with me? And it's neat to be able to pay it forward to the next generation. So I would say, look for people around you that will help bring you up on your way up. And when you get there, make sure that you help the people that are on the way up along with you.
Yeah, that's genius. All right. If you're listening to this, there's a couple key things that you should take away. One is that happiness is not going to cause your business to go bankrupt. Two is that culture really is a leadership driven thing. And this concept of the most right thing, for most of you that are listening to this, that would be a huge plus, no matter the industry. And so, Rob, I just want to thank you for sharing your story with us today. It's been great to have you on. Appreciate you.
Enjoyed the conversation, Mike. Have a great day.
You too.
Take care.